Hello, my name is Anthony Villa and I am from Alliant International University. I will be presenting my non-empirical study that explores the connection between patient characteristics and preferences for treatment in individuals with depression to help match them to a more individualized treatment of antidepressant medications, cognitive behavioral therapy, and/or mindfulness-based cognitive therapy. Many individuals with depression struggle to find an effective treatment, and it often takes a lot of trial and error attempts to find the most effective option. The overall discovery of this study indicates that the patient characteristics and their preferences influence the outcome of depression treatment regardless of the treatment options available. As we know, clinical depression is an incredibly invasive and impactful disorder that a large population of Americans endure every day. The challenges that many individuals with depression face is the ability to find an effective treatment option that is properly treating and improving their overall functioning. Most of the time, individuals are switching from one treatment to the next, trying to find that one treatment that is going to be the most effective for them. And as we know, the field is moving towards more individualized and client-centered or patient-centered treatments. And having some of these options be a little bit more personalized can help improve the overall functioning for each client. The literature review explored 3 different depression treatment options: antidepressant medications, cognitive behavioral therapy, and mindfulness-based cognitive therapy. Antidepressant medications and cognitive behavioral therapy are 2 of the most commonly used, while mindfulness-based cognitive therapy is becoming more popular as the use of mindfulness increases in the field of clinical psychology. Each of these 3 treatment options have been scientifically proven to be effective. Antidepressant medications and cognitive behavioral therapy have been shown to be the most effective when used together. Mindfulness-based cognitive therapy has been found to be the most effective in treating individuals with treatment-resistant depression and for those individuals who have had more severe or long-lasting depression. This is typically for individuals who have depression relapse, where they're out of a depressive episode, then maybe they fall back into a depressive episode relatively easily. While exploring the patient characteristics, there were numerous studies that suggested that older individuals were more likely to prefer medications over psychotherapy, and individuals from more collectivistic cultures were more likely to prefer psychotherapies over antidepressant medications. However, it's also important to note that there are some challenges in getting individuals from collectivistic cultures into therapy. Comorbid diagnoses and disorders also played a role in determining which treatment options were more beneficial. While examining the individual's preferences for the treatment, this seemed to focus primarily on the characteristics of the treatment, whether that individual wanted or preferred psychotherapy over medications, or a treatment that provided a mindfulness component, or a treatment that had more or less in-person versus online connections, individual or group components. However, there were also aspects such as cost-effectiveness, side effects, that influenced in many individuals in their preferences. The combination of information gathered during the literature review suggested that even though patient characteristics are important as they play a role in how the individual interacts with the world and how the world interacts with them, it was not necessarily the most influential facet. When individuals receive their preferred treatment options, they are more likely to be engaged in treatment as well as maintain it, even when challenges arise. Whereas if an individual is given treatment formats they do not prefer, they may be more likely to be inconsistent or withdraw entirely from the treatment, especially when challenges arise. This may be also due to their lack of confidence or comfortability in said treatment. Since we know that individuals' preferences for treatment is so valuable in keeping them in treatment and leads to more successful outcomes, it is vital that clinicians collaboratively work with their patients to increase their knowledge of the options available and allow them to determine which options they might prefer or feel more comfortable with. Including the patients in the decision-making process will ensure they are more comfortable with the ultimate choice of treatment and could lead to better match, therefore more successful outcomes.